Why might someone receive a false negative STD diagnosis? Have you ever wondered why someone might get a false negative result for a sexually transmitted infection? A false negative means the test says a person does not have an infection when they actually do. There are several reasons this can happen, and understanding them can help manage sexual health better. First, testing too early can lead to false negatives. Many sexually transmitted infections have a window period. This is the time after exposure when the infection is present but not yet detectable by tests. For example, an HIV antibody test may not pick up the infection until several weeks after exposure. Next, the type of test used can affect results. Different tests have varying levels of sensitivity and specificity. Some rapid tests might miss low levels of infection. For instance, if a urine or swab sample is collected improperly, it may not detect the infection, especially if it is located in a site not sampled. Improper sample collection or handling can also cause issues. If the sample is taken from the wrong site or if there is not enough sample volume, the test may yield a false negative. Additionally, if samples are not stored or transported correctly, this can degrade the specimen and reduce test accuracy. Another factor is the organism load. Some infections might have low levels of the pathogen at the time of testing or may shed intermittently. For example, the herpes simplex virus can be latent, meaning it is not always present in detectable amounts. Laboratory or technical errors, while less common, can also lead to false negatives. Mistakes in processing or issues with test kits can affect results. Biological variability plays a role too. Individual immune responses can vary, which may delay or reduce antibody production. This can affect tests that relying on detecting antibodies. Lastly, if a person has taken antibiotics or antiviral medications prior to testing, it might suppress the infection to undetectable levels, leading to a negative result despite an ongoing infection. Given these factors, it is essential to consider repeat testing if there has been recent exposure or if symptoms continue despite a negative result. Using the right test at the right time is crucial, keeping in mind the specific infection and its window period. Testing multiple anatomical sites may also be necessary if exposure occurred in different areas. Consulting healthcare professionals is vital for personalized advice and follow-up. Some infections requiring specialized testing methods. Understanding these factors can help reduce anxiety and ensure appropriate management of sexual health risks. Remember, a single negative test does not always guarantee the absence of infection, especially shortly after exposure. Ongoing communication with healthcare providers and following recommended testing schedules are key for accurate diagnosis and effective prevention and treatment of sexually transmitted infections.